Hello, everybody. It is Monday afternoon. Today we're going to have our update on COVID. We're going to talk about schools and our recommendation for how we move forward. Talk about some good news on the budget side, at least for this month, but some tough news coming up if we don't have some action out of DC. Talk about the new guidelines for bars and restaurants, where we're going to attempt to provide the types of rules where we can have people coming together safely at one of those places instead of gathering somewhere else. And then Eric Freelander has a couple of really positive awards from the federal government that have come our way that are going to help us out. Let me first start by reiterating that we are still in a very difficult, dangerous place with a virus that is spreading so significantly right now. One of the foremost experts this morning on one of the cable news shows talked about it raging in the United States. And so it's really important that we remember that while I believe that we have stopped the exponential growth that we've had in Kentucky, that these masks are working, we are in, at best, what I pray is the apex of where we will be in this virus. In other words, if we are doing really well, we are still in one of the most difficult times. And the good news that we reported yesterday is a little more complicated. So yesterday we reported that our total number of cases for last week was almost 300, or 300 and a little more less than the week before. But today we've learned that our IT provider for that system had been updating the way the system worked over the weekend, and not all reports have fully gotten in. This is unacceptable. We are going to be addressing it with that provider, but what it's going to mean this week is we're going to report initially some numbers that are going to be artificially low. We know that, and so Monday, Tuesday, and Wednesday of this week, I will be reporting Monday, Tuesday, and Wednesday of this week as they come in, that we will have to revise some of the previous days as more of the information comes in. Now, what I believe it means is that last week's numbers were closer to the week before. I don't think that they were significantly higher, but I don't think that they were 300 cases lower. So where we need to believe that we are, or where I believe that we are, is we have stopped that growth month after month, but it's something we got to fight for. It's something we've got to continue the very best practices, and ultimately we can't just stay where we are. We have got to start decreasing our cases because otherwise we sit in a place where they can skyrocket again very, very quickly. And so that brings us to a tough but a necessary recommendation that I made today to our public school systems, and I think our private schools were there too. And the reasoning behind our recommendation is important. Let me start with, it's a recommendation I'm making as a governor, but one that I have to live with as a dad. My son's supposed to start 6th grade. They would have already started, I believe, in the school district that he's in here in Frankfort. And my daughter needs to get back in in-person classes too. In my very core, I want us to get back to in-person instruction. But to ask our kids to go in, and all of our teachers and faculty, at a time when it's not safe is something that we can't ask of them, and I'm not willing to. I want to go over 4 reasons for the recommendation that we are making. One is, if you'll show the chart of where Kentucky is right now. This is what we were talking about, in that in the past 5-6 weeks, we have seen an increase from that plateau that we were at to where we are now, July being our most difficult month. And even if last week's numbers stay right, 3,797, we think they're a little more. Last week before that, 4,106. Week before that, high 3,000s. That means we have been at a place in time where we've had almost 12,000 cases in 3 weeks. That we right now, again, are what I pray will be the highest area that we're ever in Kentucky. And the concept that we would try to resume in-person classes at our peak instead of during a decline is something that would defy logic, wouldn't be safe to do. Second piece is what we are seeing in Kentucky and across the country, an increase in infections in our kids. We have seen it both here in Kentucky, where I read just the kids 5 and under lately, and it's heartbreaking in how much those numbers are increasing. And then hopefully you all saw this news nationally, 100,000 kids tested positive in the United States in just the last 2 weeks of July. It is a myth that kids do not get this virus. It is a myth that kids cannot spread this virus. And so what we are seeing is a significant increase in the infection rate of our young people, and understanding that when they go back in school, they can spread this not only to each other, but also to the faculty and other members of the building. And let's also remember that while there are significantly fewer bad outcomes with kids, there are still bad outcomes. And the more we create a situation where the spread can increase even more significantly than it is right now with our children, is when we expose more children to that risk. Other thing that we're seeing is an experience in other states. It seems some of the same states that rushed to reopen really fast and went through some of the largest surges are also reopening their schools to in-person classes the fastest. And whether it's a couple schools in Indiana, whether it's schools across Georgia, we are seeing schools open up for 1 day, 2 day, maybe a week, and then shut down. And that's something that we can't walk into expecting or hoping for. We have to have a plan, and I have to make a recommendation that gives us a real chance of success. That you don't send your kids to school for 3 days, school shuts down, it takes another week and a half to get distance learning up. You do distance learning for a certain period of time, never knowing when you might get back to in-person classes. This is more disruptive, in our opinion, starting and stopping, than a plan that can have an opportunity of success. And then the last reason, and it's one that we begged and pleaded on, but continues to be a challenge, and that's through the month of August, our families continue to go on vacations to places where the virus is so hot. And while we have put our travel advisory up and we've got those states, we continue to see families go to the beach, whether it's in Myrtle Beach or in the Destin area. Every time that happens, you can bring it back to your workplace, which is trying hard to keep it out, your church, or, heaven help us, a school. And because of that, plus conversations with many of our superintendents that have said that they need to go ahead and make a plan for whether they start with distance learning or whether they alter their calendar, we are making what we believe is a realistic recommendation that's a tough one, but one we believe can give us some success. It is one where we are not going to simply say 2 weeks from now and then delay it 2 weeks from then and delay it 2 weeks from then, and potentially prevent school systems from taking some steps that they can to do the best they can to educate our kids, even if it's remotely during that period. So our recommendation today is that schools wait to begin in-person classes until September the 28th. Yes, that's about 6 weeks from now. But it's also 6 weeks from what I hope is the peak of this virus. 6 weeks from the last 3 weeks where we have been pretty much at all-time high week in and week out. 6 weeks from a time when we just had a 6% positivity rate. Let's face it, we're trying really hard. And we've got good steps that we've taken. Masks are working, but we do not have control over this virus. And to send tens of thousands of our kids back into in-person classes when we don't have control on this virus isn't the right thing to do for our kids. It's not the right thing to do for their faculty, and it's not the right thing to recommend as governor. And there's some that'll, I know that'll say this is, a decision being made by the governor. It's a decision being made by the virus. We're living through our pandemic. Whether this is our Spanish flu, whether this is our version of the plague, and if you think about it that way, we're pretty blessed compared to what happened then. It's not going to be easy. And lots of sacrifices are going to be made. And yes, our kids are falling behind. My kids are in that developmental time when they need to be in school. But their overall health and safety, along with that of their teachers and others, has to be paramount. And we have to have a plan that has an opportunity of working. We're going to be working very closely with our Department of Education, with our superintendents, on trying to provide all the flexibility we can, with the ability for them to bring small groups of kids in, whether that's to get Chromebooks, to provide some instruction on how to use them, to get an idea of what the schedule will be moving forward if they choose to do that. Flexibility in, they already have this, maybe changing some of the days of the calendar. Right now, it would be better if our families did not take vacations during a semester of our school year, and that's one where we could eat at certain days that are out there. I'm pretty sure our kids will go to school any day we ask them to right now. So a tough but a necessary step. And again, I believe we're going to be through this beginning of next year when the vaccine gets out. But until then, we're going to have to make difficult choice after difficult choice to survive. And surviving and protecting each other is what we are trying to do. So that's the recommendation that was made today. I believe it's the right recommendation. Everybody won't agree with it, but my job here is to make the tough calls, is to move any type of politics out of it and just try to make the right call, both as governor and a dad. All right, let's move into some slightly better news than that, and that is our general fund and road fund receipts. The budget of our state is how we pay for our teachers, how we provide those SEEK dollars, how we are able to provide health care and that safety net that's so critically needed right now. So in some good news today, the state budget director announced Kentucky's general fund receipts for July, the first month of this fiscal year. We run a July 1st through June 30th fiscal year, totaled nearly $905.1 million, a 7% increase compared to last year when we weren't dealing with this virus. Collections for the month were surprisingly strong given the general slowdown in consumer spending arising from the coronavirus. Now, that's really good news. It suggests that our economy is still afloat, but we know what it's taken to keep it afloat. The first was an investment in the states to respond to the coronavirus, the first CARES Act, that while not giving us a lot of flexibility, helped us defray costs and pay for new costs. The other is the additional $600 in unemployment that was provided to the people of Kentucky. All the data that we've had show the people of Kentucky are doing what we need them to do with those dollars. They are spending them. They are ensuring that they meet their families' needs. They are providing for themselves. They are helping our economy in so many different areas. And so the federal government is going to have to come to some compromise, and or the executive order from the president is going to have to be changed in a way that continues some level of that support. Without it, every state is going to be faced with incredible difficulty. The executive order that was put out by the president, I believe, was an attempt at moving forward. I will say from a state standpoint, it's not workable in its current form, and hopefully either it will be revised or even better, Congress will actually come to an agreement. So the first challenge with it is that there's only enough money set aside to last for about 5 weeks. And right now, states are being asked to enter into agreements that may have to run through the end of the year. The second is there's no guidance on it. So we'll be asked to enter into an agreement where we don't know what the federal government's going to do because they haven't given us the full guidance on how it'll work. The third is states are expected to chip in 25% at a time when our budgets are already struggling, and if we have to cover the remainder of it through the end of December, we're looking at $1.5 billion. It'd be a much smaller amount for the month or 5 weeks that the federal government would help, and then after that it would become absolutely unsustainable. And the last is concern about different state laws across the country and what it's going to take to put this into practice. And if we have to make any changes in our computer system, put in 2000, on how different things are calculated, where dollars are coming from, it's going to cause a delay in all of it. And so on a conference call with Governor Cuomo today and through this week, I'm going to be advocating first for the simplest solution. Re-up that $600 unemployment benefit. We already know how to administer it, though we've had some hiccups. It will not create another delay in getting dollars out to people. It will also continue to impact our economy and our budget in a positive way. If the federal government is going to do less than that, we need it, one, to be fully funded by the federal government. If they're going to choose $400, it needs to all come from there. But it needs to be in the same form that the $600 is currently coming from. Because if we have to change that system of administration, it's going to keep people from getting those funds. Listen, when the federal government made this decision early, it did the right thing. It has us in a place to where when COVID is gone, we can rebound and our recession doesn't turn into long-term recession or even depression. They've created a positive environment that will allow us to bounce back, but we cannot abandon that right now. So good news in this last month of the budget, but we need congressional action or a change in that executive order to move forward. Our future economy absolutely depends on it. Next, let me give the update on our numbers today. They are artificially low because of this computer glitch that is now requiring our epidemiologists to go through duplicate upon duplicate upon duplicate that have populated our system that we have to get through to provide additional numbers. So today, and this number will be revised tomorrow, we're reporting 275 new cases of COVID-19, which brings our state number to 35,254. That needs to have a giant asterisk on it because we know that number is higher and will change. And to give you an idea, we had 300 plus last Monday. I think we'll probably be around the same mark. Now, that doesn't mean that that's bad news. We knew we had to slow this thing down and it would likely plateau first. But we do know that our numbers are going to be artificially low for at least the first couple days of this week. Our current positivity rate is 5.71%. That's good that it's down from 6. We'll have to see as the other cases come in and are adjusted, but we will have some of the negative reports coming in as well. Total number of tests are now over 700,417. We've got in the hospital right now 641 Kentuckians with 155 in the ICU. At least 8,738 Kentuckians have recovered. We're reporting 2 new deaths due to COVID-19. Thankfully, these numbers have stayed low. We hope we are getting even better at treating this virus. Those deaths come, if I can shuffle my papers, from a 98-year-old woman in Lincoln County and a 60-year-old woman from Graves County. A couple other details from today. When we look at cases by county, just a couple of notes. A large number from Kenton, 41. Hopkins, 33. Graves, 25. Logan's got 23. Shelby's got 21. Adair has 19. Butler has 15. So Jackson, 14. Edmondson, 12. Grayson, 11. Muhlenberg, 11. Casey, 10. So we are seeing more and more counties that haven't had as many cases before, suddenly seeing a number of them. That's where the spread is. Today, 13 kids under 5 testing positive. Again, that's sadly impacted by how the reports are coming in as well. We unfortunately probably have a number of additional ones beyond that. Long-term care facilities. This shows current active cases versus total cases. At least 4 new residents and 5 new staff have tested positive. 5 new deaths attributable to long-term care. 5 additional Kentucky facilities. Child care facilities. 9 new facilities with at least 1 COVID positive. 7 staff. 5 new children. Now, I skipped the gun a little bit earlier. I want to give the opportunity, based on where we are in all this report, for our Lieutenant Governor to talk about our recommendation for schools, followed by Dr. Stack.
I'm going to be brave because I have a sleeping baby, so I was trying not to wake her up. Oh, she's waking up. It's appropriate for me to have her here today because most of you know me as Lieutenant Governor and the Secretary of Education because that's my role here in this building. But the important thing to remember is that I've spent much more of my career as a teacher and as a school administrator and as a mom. And so the decision today to postpone in-person classes and to begin digitally is one that is not made lightly. And it's one that's made as a governor and a lieutenant governor have made to recommend to superintendents. But you're also talking about parents, and you're talking about someone who's worked in a school building and who knows what it's like when the rubber meets the road. More than anything, our educators deserve to be able to return to a place of work that is healthy and that is safe. It is not fair for all of the requirements that have been placed on our schools for our teachers to be doing the bulk of that work in a situation where they could be putting their health at risk. And so the responsible thing to do is to respect our school employees, our faculty, and the families that they go home to every night. And I appreciate the fact that our superintendents have been willing to be innovative and to figure out how we can proceed in a responsible, smart way. We are asking our kids to be innovative, and so certainly the schools that we use to serve them every day can be as well. As a school administrator, I think about implementation of the guidelines, and I think about what that looks like for buildings full of 850 kids like mine was, and what the hallways would look like, and how we could make that happen. And the truth of the matter is, right now, our best bet is to give our schools time to prepare, give the virus time to die down a little bit, and to make sure, again, that we respect the folks that wake up every morning and go to work to serve our kids every day and the families that they go home to every night. And so I want to thank you, Governor, and to all of the superintendents and teachers who have been a part of this decision making as we've gone along. We've taken your advice, we appreciate it, and we will continue to seek it. Dr. Stack.
Thank you, Governor, Lieutenant Governor. So I've said this before. I said it a couple of weeks ago. I never like the days where you have to tell people what we recommend you don't do. We really look forward to the days that we can tell you the things you can do. But as you've seen me hold up before, and there's going to be some reporter who asked for this by ORR. We don't get them till the morning on Monday, so the request doesn't have to come Sunday. But so in the report here today, they still list, it's actually dated yesterday, but we get it today. We still show 53 of our counties either in the red or the yellow zone for the last week. That means nearly half of the counties in Kentucky are identified as increased concern for the federal government, and if you're in red, they're raising an alarm bell. And they still recommend substantial intervention steps, and so of course we have other steps that we've taken here recently, and I signed one of those orders today there's the mask mandate, which continues. There's also the gatherings kept at 10 or less people. Of course, there are restrictions on hospitality industry, restaurants and bars. On that point, people might say, well, why are you letting those happen? You know, it's difficult. Where states haven't allowed some of those activities in some measure, people engage in bad behaviors in their own backyards and have tons of people pile in, and they're in an unsupervised environment. Again, it's a difficult balancing act. We're trying to balance these things by trying to provide outlets where people can follow the guidelines, the mask requirement, the social distancing, the proper surface and hand hygiene, and do things that lower the risk as much as we reasonably can while allowing people to engage in activities we know are important. And then that leads to schools. And so today the governor's recommended, as he's already said, and the lieutenant governor has commented on, recommending a delayed start to in-person instruction and using non-traditional instruction to start the school year. And I was on the call with the governor and the lieutenant governor of the superintendents, and you know, this is tough. But we get messages from every which direction about teachers who are concerned about going back to school, parents who want their children in school, and parents who are concerned about their students going to school, their children, because of the concern of infection that the child may get or that they may bring home. This is really, really tough, but what we see has happened when the students come back together in athletics and when the students go to camps and when the students end up in school, you start seeing positivity rates go up very quickly. And I think what we showed in Kentucky and what the governor showed on the line graph earlier is we've had, knock on wood, good success so far interrupting these exponential climbs. So far, Kentucky has been hit by this virus. It's been hit, of course, economically and socially, but as far as loss of life, we have done a really fantastic job, all of us, all 4.5 million Kentuckians, following that guidance and keeping people away from each other and doing things we need to reduce the risk of the spread of this infection in an unmitigated, uncontrolled manner, which cascades out of control alarmingly quickly and creates all sorts of problems that we thankfully have not had to directly experience yet in the state of Kentucky. And so we will continue to try. I'll continue to try to find recommendations for the governor where we can titrate and calibrate these steps. I am very grateful to the governor. This is not easy. These decisions weigh heavily, I know, on myself. I suspect on the governor as well. It's very, very difficult. But our job is to try to mitigate these other damages while still keeping people safe, healthy, and well, and alive, because for the people most vulnerable in society, they have paid, some of them, and others will pay a steep price in terms of the loss of their life. And so thank you for all you do, Team Kentucky. This is not an uplifting message from me today, but I am cautiously optimistic that we can navigate our way through this, and we'll be stronger for it at the end. But this is our generational challenge, and when the plague went through Europe in the Middle Ages, it took out 30 to 50% of Europe. So think about that. 30 to 50% of all Europeans died in the plague in the Middle Ages. Thank goodness we are nowhere near that with this, but it is in no small part because we are trying to learn from history's lessons and trying to do things today that we know can have a positive impact and keep people safe. Thank you, Governor.
All right, we'll move next to hospitality since the good doctor brought it up. Today we've got new guidelines for hospitality, restaurants, and bars. On restaurants, we really need our institutions to continue to push people outside, maximize your outdoor seating. We are increasing the capacity again with a curfew that'll be talked about, but please make sure that you're putting as many people outside as you can. And on the bars, there's going to be questions about reopening. If we don't, people are pushed towards large house parties we've seen in other states where absolutely no rules are followed. Our goal is to have the right structured rules where people can have that outlet if they're looking for it, but to be in a safe place and for it to be done in a safe manner. And again, this is something that if folks can't follow, we'll have to take other steps. So, Latasha.
Good afternoon. There we go. As the governor said, we are issuing a new order today, effective tomorrow, which will allow bars to reopen and restaurants to open at 50% of their capacity. Both bars and restaurants will operate at 50% capacity inside, and as the governor said, we want to promote people still using that outdoor space and maximizing that outdoor space, because in the end, everyone's a little better outside when doing this. We want to hit a few really important requirements to help keep bars open and restaurants open at this capacity, and all of these details can be found at our Healthy at Work, which is healthyatwork.ky.gov. But some of the big points are, we want everyone to stay seated, whether you're in a restaurant or a bar. You should be at a table with your group or your household, and there should be 6 feet of space in between each of those tables. And the governor has put up pictures before where we found bars, people shoulder to shoulder. That's exactly what we don't want to happen again. And plenty of people did it right. We just want to make sure that with this fresh start, everybody gets off to the best start and we can keep things open and nothing contributes to spread of the virus. There's no congregating at the bar, so if a restaurant or a regular bar has a bar area, service should still be at the tables. No one should be sitting there congregating. The mask order is still in effect for bars and restaurants, which means if you're not actively eating or drinking at your table, then you should be masked. If you're going to the bathroom, entry, exit, otherwise you should be at the table and enjoying your friends and beverage and food. All food and drink service should be stopped at 10 p.m. local time. Wherever you are, Central, Eastern, it's just 10 p.m. And then afterwards, the bar and restaurant should close at 11 p.m. And all staff and customers need to wear masks as indicated in our other guidance. And so by following this, we hope that everyone can stay open and we can enjoy these great restaurants and bars that we have in Kentucky. Thank you.
Biggest change for our bars is an enforced seat rule. Easiest way you can see whether a bar is following the rules and regulations is everybody has a seat and everybody's sitting in it. No congregating. You're in that seat unless you're going to the bathroom, and then you're back in that seat. It's the only way we can make this work. If folks won't do it, it will present a challenge that we cannot overcome. So we got some good news today from Secretary Eric Freelander about a couple of recognitions and then monetary awards to the state.
Thank you, Governor. First thing I'd like to talk about is certified behavioral health clinics. This was a program that was passed in 2014, and 8 states applied for this, 50 states applied for it, and 8 states were rewarded. But with the CARES Act, 2 more states were allowed, and Kentucky is one of them. And just to show that taking care of people is not political at all, this application was first written in the previous administration. So this shows that taking care of our people is not political, it's something we are all called to do. So what this does is allows us to provide comprehensive services to folks with behavioral health needs and significant substance use needs. This allows a comprehensive clinic to provide for physical health as well as behavioral health and case management services and transportation services. This allows our behavioral health partners at the local level, like our comprehensive care centers, to provide services for these folks who are most in need. People with severe behavioral health issues die 25 years younger than the rest of us. So these services to provide to folks, it's going to help people all across the Commonwealth. And in this time, when we're dealing with a pandemic and all the uncertainties that we've talked about today, that makes these services all the more important. And we are very fortunate to be one of 2 states that received this award. The second is, in the next slide, I often hear asking individuals to sign up for Medicaid and SNAP. This is a little different. The CARES Act allows our providers to sign up for some significant reliefs. It's 2% of what they are their normal revenues. And through the CARES Act, they can apply, and the information's on the screen. And so far, only 200 providers in Kentucky out of 22,000 that are eligible have actually signed up through the federal government for this additional support. We all know our health care providers need this support. So, the numbers on the screen. If you are a healthcare provider providing CHIP services, if you are a dental provider, and we know our dental providers have been hurt through this, this is a way to get support. So please take the time and sign up. Thank you.
All right. We'll just move forward. We'll do some more positive social media tomorrow. But given today's announcement and open it up for questions, we got a whole room full today. Debbie, if you got one, you want to kick us off?
Did you get a response from the superintendents in private schools about your recommendation? And what about higher ed students who are entering campus?
Question is, have we gotten a response from superintendents on the call? There is a webinar scheduled for tomorrow that the Lieutenant Governor is going to be on and others with them to discuss it. I expect all types of reactions. I mean, the first is that, it's tough. We all want to get our kids back in school. I desperately want to get my kids back in school, and I am for getting our kids safely back into in-person classes even during this pandemic. It's just getting them back at the height of the pandemic, I think, would be irresponsible. So our goal is to ensure that we have our timing right, that we don't act like some of the states that reopened, the fastest and reap repercussions, and that we shouldn't want our kids to be the canaries in the coal mine. I'm sure that there are those that will say they were already planning on doing digital learning. There will be some that say, well, we think we have a really low positivity rate here, but this is spreading everywhere when you've got some of the counties that we saw today that suddenly have a lot of cases. Will it be popular? I don't know, but I know that it's the right thing to do right now. Lawrence. Oh, higher ed. Higher ed is a little bit different in the fact that kids are housed a little differently. They are not going back to parents and grandparents that take care of them each day. Kentucky, I think, is number one per capita in grandparents raising their grandkids. And so we don't see some of those issues with higher ed. Higher ed has a housing component, and then they have an instruction component. Then that can go online, and the flexibility is a little bit different. We know that the connectivity issues are less or easy to manage than what we're going to have to do to help out our school districts. And we know that higher ed is probably connected more with the city and the community that they're in, and how spread is going to happen even than others. So I believe that we have some good plans that are out there, though, that provide more flexibility in higher ed than in K through 12. I think the difference in the impact of starting and stopping in K through 12 and then what it'll take to get kids in a different learning environment takes a lot more work and even a lot more days than higher ed. Lawrence.
What does that do in terms of stopping or curbing the spread of the virus? And part of the problem.
So the question is for restaurants and bars, what do we hope to get from the curfew? Well, what we've seen is as the night goes longer, maybe as people have been out a little bit longer, that they are less likely to follow the rules and restrictions that bar is probably trying to impose. The other thing we're seeing is on the restaurant side, they tell us that their folks get off and then potentially go to the bar and then bring the virus back to the restaurant. So what we're trying to do is to create one time where it's a time where hopefully people are still at their most responsible, that folks can get out, can enjoy, but at the same time can then go home and do so safely. Our belief is that with the rules and regulations we have in place, that there is an opportunity for our bars to operate responsibly and to try to give them that advantage or that opportunity of operating responsibly. It's going to look very different. It's going to look very, very different. Joe?
As far as the recommendation for schools to start the delay in-person classes, that's only a recommendation, right? It doesn't have like a enforcement law or anything like that. And if that's the case, what's going to happen if districts decide to go against that recommendation and hold in-person classes anyway?
So the question is, what's the impact of the recommendation? It is a recommendation, but it's one that we made based on our discussions with the Department for Public Health, with the Kentucky Department of Education, based on where the numbers are right now, with the increasing number of kids that are testing positive, with what we're seeing nationwide, and the fact that so many schools right now that are trying to go back in the height of the virus are not succeeding. I believe that it's now is not the time, not at the apex, or what I pray again is the height of our cases. If a superintendent ignores it and goes back, they're going to have to answer to parents that right now probably want their kids back, but the moment there's an outbreak, again, that decision's got to rest on that decision maker. That's why I believe that we make the right decisions, not the popular decisions, believing that people will be able to accept them in the long run. The other challenge is if you go back too early, a school can possibly create a spike in a community as well that can have longer term impacts. But I think the last piece is if you come back for 3 days and then have to stop and then have to get distance learning going, it might hurt your students even more. My hope is that we can work with every district, provide flexibility, work with them on their various needs of getting some kids in and out in small groups, and then we can come back at this date, which gives us enough time to hopefully knock this virus down and be ready to start and continue in-person classes to where we don't have to pause them. Now, in reality, I think just about every other state is going to end up where we are too. What I was faced with is, do we continue to say, okay, these 2 weeks have expired, we need 2 more weeks, and then we need 2 more weeks, when realistically, we were pretty sure we were going to have to ask for 2 sets. Hopefully this gives more certainty to help our superintendents make the best decisions they can. Mike? Questions about our kids falling behind and plans to develop a plan for bridging the developmental gap. That's something we absolutely want to work with our superintendents and others on, and I'm flexible. Normally we have a fall break. I'd recommend, especially with where we're saying to start, that there's not one, because our families can't be going on vacations right now if we want to keep those facilities open. I think if we're going to wait on in-person classes, then some of that time when you get out for Christmas break, obviously not the holiday itself and right around it, are times that I think our kids would happily be back in class, having not seen their friends for as long. And what it means at the end of the school year, I think we should discuss too. We have faced times, whether they are wars or pandemics or struggles where different generations have had to face this. Our job is to be flexible enough to know that what was a round hole with a round peg is now a round hole with a square peg, and we're going to have to do things a little differently for the next year or maybe even 2 years to make sure that we don't leave our kids behind. And so as a parent, I'm going through this with them. It is hard. Teaching your kids math is hard, not because you don't know math, but because they don't listen to you. We've got, right now I have my kids over for lunch. It's just me in the office. And then I turn into math tutor for 30 minutes of my day when I pause being governor. And I always respected our teachers. I have newfound respect. But there's so much more our kids are missing out in school. And I hope people know that. I not only know, I feel that, but the risk is just too great. And it's making a decision between 2 very difficult things, but we also can't sacrifice our teachers and administrators on the altar of COVID. I mean, they right now would be exposed to more kids that have more trouble social distancing than and more contacts than in many cases some of our healthcare professionals do. So we got to make sure that we are aware of that and get the virus to a place where they're safe as well. Tom.
Well, you skipped past Karen.
Oh, I missed it. Karen, I'm sorry. No.
The reality is there are a lot of children who rely on teachers and educators to notice if there is anything going on at home as far as safety.
Yeah.
Some of these children now won't be seen by any of those people by up to 6 months.
Yeah.
How worried are you about cracks happening all to stop that?
Yeah. The question is a worry about kids that teachers or our friskies who are also educators often notice and are able to provide help. I'm very worried about it. I'm very worried that we don't see the manifestations of child abuse, and that puts our kids at risk. I'm worried that we don't see the signs of neglect in the same way. Those are all things that weigh heavily. But getting kids back 1 or 2 days and then them having to leave, we also wouldn't be seeing those. Our goal is if our schools move to distance learning, we've got to make a real effort to make sure every child can access it. And we're looking at different opportunities there right now and want to work with the districts on that. Places where there's not ready internet access, what can we do? There's a couple of potential solutions there. How do we connect our counselors and others with those children and try to have some of those same wellness checks? I think our educators are innovators, but that doesn't mean that this virus isn't hard and that its impacts just like that aren't hard. No, we won't. We won't notice as many kids. That makes the decision that much tougher. Tom.
Go back to something you mentioned earlier when you were reading off those double-digit new cases in counties. Quite a few unusual ones in there. Has there been anything that you've heard, anything through contact tracing on why these are suddenly becoming hotspots?
So the question is, with new counties that we are reading out in the double digits, there's a lot of new ones in there. That's what we're seeing nationwide. Dr. Burks talked about it when she was down here. We hear about it on our national calls, that we are seeing more spread in rural America and in rural Kentucky of this virus than ever before. What we're seeing is a lot of cities, not necessarily all of ours, we actually see some increases in ours, are plateauing, and that's probably because the number of people that have been exposed to it thus far. Sadly, that's one of the reasons that the virus sometimes comes down, not the one that we want here in Kentucky. We want to keep it down. But we're seeing spread across rural America at a much more significant rate, and we are also seeing what you would look at and say are explosions of cases in different areas. A couple things we know are contributing. Travel. We are seeing that especially in rural Kentucky, and then sometimes failure to follow some of the social distancing and masking. We think we're getting better in that. Heard from the county judge in Harlan County about how much better their masking compliance has been and how their cases are leveling off. That's a very good thing given how hard that county was hit, and that shows great leadership there, but also the great people that make up that county. But it also should be a warning to us about how quickly, where this virus is right now, that in any area it can take off, and that should guide some of our decisions, and also mean that nobody's immune and nobody has a low level of COVID. It's there. The question is, how fast does it spread, and also, do we catch it with our testing? Nick?
Real quick question. So, just to clarify, you're still requesting schools begin education August 26th, but you're just asking them to push back?
Our recommendation today is to push back in-person learning until that September 28th date. Groups that want to go ahead with online learning, digital learning, I think they ought to. Those that want to try to change their calendar in significant ways, to maybe do a little bit less of the early and a little bit more of the in-day classes, we want to be flexible with all that. We know that different school systems are a little bit different on how they want to address it. We just know that where the virus is right now is what I hope is the top where we'll be. And to reopen right then instead of on a decline, I just think would be a big mistake.
In terms of organized sports, obviously you're concerned with cases in young people.
Yeah.
Sports are still happening. Where do you sit on that?
So the question is on organized sports. KHSAA, I know, is going to meet tomorrow. It looks like the Big Ten might even cancel their season. I do want to not make a false equivalency, though, between a whole school of kids that are there with multiple kids for hours upon end in a classroom potentially with a teacher, and what may be a 1 hour tennis match where people are separated. So I don't want to make just the false equivalency that people often make about being in a place where you are for an hour versus going into the grocery store, spending 20 minutes and leaving. There are just different levels of exposure that are there. But I think we'll learn more from KHSAA. I certainly think that there are some fall sports that are going to be a challenge to hold. I still think that there should be consideration with moving them to spring. That creates some differences, but we may see that on the college level too. Chris.
I met with the owner of the Great Flood Brewing Company today, a guy named Zach Barnes. He expanded into Middletown at the beginning of the year, and as you can imagine with a restaurant and brewery, it's been very tight. And in my talk with him, he had a question that I wanted to pass along to you, and he said, are you making plans to best explain and lay out future guidelines, future expectations for that industry to better reward those who are trying to do the best they can do and the best that they can provide safety for their customers and their employees? They just want to know how to plan for going down the road.
It's a question from an owner, and it sounds like a really responsible owner of a brewery in Louisville. I guess he's got a couple, and I may have had one of their products once, and it was good. But a question on an outline of future expectations or how we'd respond, and I think what he's given voice to is the unfairness. It's the unfairness of the virus, but also that bad actors in an industry can cause real ramifications and harm to good actors. I will say that we need to step up the enforcement on our end. Now, a lot of our areas have their own ABC. Those are the groups that would go out. And we're going to have to be brave enough to actually take steps. Shut places down. Issue fines. Because if we don't do the enforcement, the bad actors will do what they do. The virus will potentially spread, and then that could impact the good actors. And so I would say on our side, that's something we need to do. I would say on the operator side, if you're operating in the way of the new guidelines that are out there, you look very similar to a restaurant. We believe it can be done safely. Those that are doing it, we want to recognize in some way. And yeah, it's like everything in this virus. It's unfair the impact that it has on so many. We'll do one more round. I've got a number of written questions I'll try to do. Debbie?
Is this worse? So when it is back up, this again brings up the question of the Derby. Let's talk about that.
Question is on the Derby. I had a conversation with the CEO today. I believe they're going to have more information this week. I will say that they are taking steps to significantly reduce the numbers of people that would be there for live in-person viewing of the Derby. Where their numbers are already right now, I think would surprise people when they talk about them, but I do believe they are trying to take more than reasonable steps. I think they're trying to take very active steps to create a safe environment, and I think that they are on the path to do that. So I think they'll have more information this week.
Talk about this computer glitch, how it's affecting the numbers, and talk to people who have doubts about numbers anyway.
Well, the questions on the computer glitch and the numbers, and let me start on the second part is, what about people that already have questions on the numbers? Folks, don't try to just disbelieve that there is a worldwide pandemic out there. And there's some who don't want to believe it and will question the numbers. Are the numbers for a disease that didn't exist until late December and a test wasn't created until early in the year going to be perfect? No. Of course they're not going to be. But once you reach 30,000 positive cases, are they pretty accurate, and does it tell you where the virus is? On a day that we have 600-700 cases, does it say that the virus is growing? Yes. The numbers in the aggregate tell us where we are and are valid to tell us where we're going. And continued attempt to disbelieve the numbers or to say this is just like a flu is sticking your head in the sand while something rages through our communities and potentially kills people that you know. And there have been more people in the last week that I know that have tested positive for COVID than in any other week that I've experienced. And this thing is real and it's out there. Stop disbelieving and just do the steps to battle it. If you don't want the numbers to be as high as they are, don't try to argue with them. Put on that mask and do the things we need to do to decrease them. Now, the glitch we've had is Deloitte does our computer system, and they were changing the way that the operating system worked in some way that I can't explain and frankly don't understand. And that's why I don't work at Deloitte, I work here. But what it caused is the numbers at that point, it was really, I think, about midday yesterday. So I think it had a small impact yesterday, probably had a big one today, and it'll be tomorrow. Created through all, I believe, of our results, whether it's COVID or other thing, into one pot. We think we have a number of duplicates in there, so we're not releasing any of those until we know they are single, individual cases that can be relied upon. It just means we have a ton of work. We normally have a lot of work, but we have a ton of work before release to make sure they're accurate. So those who think that the numbers aren't right, we're holding other positive numbers that we know will be there so that when we put one out, that we know it's real and it's confirmed, and that it can be relied upon. Here's the challenge, though. I mean, we've got the federal government at different times changing the way they want things to be reported, so we got to go in to try to change that. And every time you go in to try to change something in a major computer system, something screws up. And if you're me, your email doesn't work or your calendar doesn't work, and then you have to go back in and get that helpful person to fix it. This is happening too, even in this system. Numbers overall accurate. Is there one or two here or there? I'm sure that you could find, but what we see here is reflected ultimately in what our hospitals tell us, and so many other ways of getting information. Joe, and then Karen, and then Mike. So the question is on comments I made on the conference call today on the President's executive order, or where we are on the unemployment. And what I said today is I'm not going to criticize the White House because I do believe they tried to do something. At a time when nothing was happened, I think they tried to do something. Now, what they did doesn't work and won't work for states. There are a number of issues in it, and we don't have guidance. So all I want is for it to be fixed. That's what people ask me, right? And the unemployment, fix it. And we're working really hard to do that there. The best fix here would be Congress to pass a new bill that I would like to see re-ups the 600. But if they're going to go for 400, they do that. There are some that have questioned the legality of the President's executive orders. It'd be interesting to see if others here in Kentucky had that opinion. But if that's the way that it can be fixed, fix it there too. So again, just because I was talking about how the executive order that was issued isn't going to work, doesn't mean I want to criticize somebody for trying to do something. My goal is just to help our people during this, and the federal administration has worked fairly well with us, but it is important that they hear from a state that has worked with them about where we are right now. We either need that legislation or a fix on the executive order side. That's a question. I haven't read and analyzed the payroll tax deferral part of the executive orders. What I will say is we're getting lots of different messages right now about how something would work and what would be forgivable and what wouldn't. I mean, we've heard everything from if we ask nicely, the federal government might, by a state-by-state basis, provide the extra $100. If that's the case and that's somehow legal, I'll ask very, very nicely for it. We've heard that maybe you can go ahead and get the $300, but you have to forego the possibility of the other $100. But this is when an order's been signed and we don't get guidance for a month. That's challenging. And I know sometimes it's taken us a little bit of time to get up our guidance, but it makes making a decision on what we do very difficult right now when we're supposed to enter into an agreement. But if it spurs further negotiations, then if it spurs quick action that creates a good resolution, then we'll take it. This is the first time that this issue on the update of the system has occurred. We've had other issues about when data's come in, whether it's a lab held a lot of results or a new lab didn't know they were supposed to report. So this is on the technology side. This is on the technology side this time. But you look at the fact that we have more than 4 dozen labs now at least. that are supposed to be sending in results. We have all our local health departments that have different emergencies that pop up there. We have all of our hospitals and the data that comes in. It's a not an unwieldy, but just a very complicated process where data comes in so many ways. But that's why we remove duplicates, on later days, and we even show what we remove. It's why we do audits. It's why we even look back at reports of deaths and ensure they should be in there. So we have quality control, but we also have transparency. I mean, I learned about this computer thing this morning, and you all are learning about it. My first opportunity to tell you with the best way that I can explain an issue with the computer system.
Governor, are you aware if there's a way you can opt out of not having the payroll tax taken out of your pay?
We don't know yet if there's an opt-out on the payroll tax. Again, there's just so much uncertainty that's out there about these new orders, and all I'm looking for is it to be fixed one way or another. I know that the simplest could be legislation, and let me say I still think there needs to be legislation because we do need state and local budget assistance, and this has gotten bogged down into red states or blue states. This is all 50 states. Every state's going to need help, and whether or not each state bounces back as quickly as we want from this recession, or it turns into a longer term recession or depression, is going to depend in large part about budget stabilization. In fact, when you look at the Great Recession, one of the things that helped early on, but some of the studies have said if we would have continued to have support, we could have gotten out of it faster. And we all want to get out of it a lot faster. I think we've talked about that part a number. Let me just answer one question here. And we have a lot of questions on are we going to pay the 25%? We got to have more information. And just about everybody right now is in the same situation we're in, and we hope that this is moving towards a resolution that gives us all more certainty. Is the governor amenable to changing the table distance requirement, and why or why not, and what would it mean to the overall COVID-19 strategy? We allowed some changes before the September hearing. I don't know what it would do on the strategy before the hearing. We always want to make sure that we're listening. If folks think that there's a better way to protect individuals, we want to look at it. But the number one thing that I can ask of restaurants right now is continue to seat people outside. The fewer positive cases that we have in or related to restaurants nationwide and here in Kentucky, the better for people, the better for your restaurant. And again, it's not fair that you've borne the brunt of so much of this, and we hope that we can help revive so many of your businesses that I know you've poured your heart and your soul into. All right, that's today's report. I know we've gone just a little bit long. We'll be back tomorrow at 4. Again, we're going to be revising the Monday, Tuesday, Wednesday numbers of this week each day. I know that we think that they are closer to where they were last week, but even that right now is some success. We are seeing hopeful signs. We just need time to make sure that we can truly defeat it and get it to an area where it's safe to reopen those schools to in-person classes. I'm going to work as hard as I can to make that happen, both for my own sanity with my kids, as well as their developmental achievement and where they're going, along with yours as well. Thank you all very much.